Hi, I'm Bill from Trauma Monkeys. I wanted to do this video today to talk about a problem that keeps creeping up. It's a training scar and it happens often. We just did a great week of training with some EMS folks, and one of the things we saw really often was when they were trying to deal with hemorrhage control, they were trying to deal with really bad bleeders, they were doing a lot of just covering up of the wound. And the other thing that we saw a lot of was just lots of bulky, fluffy dressings. I don't have abdominal dressings like this here to demonstrate, but we would see a lot of them fluffy, layers of them on top of each other and just sort of covering it up. This is an H dressing. I kind of brought this out to show you, and this is a good pressure dressing with a bandage on it, but it does have this huge absorbent pad. And you know, the more of these things you layer in there sort of between the top and the wound, the more absorbency you're going to get. And absorbency, not a good thing. Absorbency is not a quality we're looking for when we're trying to do hemorrhage control. We want to keep every drop of blood in the patient, in the circulatory system, so that the patient can benefit from those red blood cells circulating oxygen and keeping them alive. And when we add lots and lots of fluffy things, like a towel, right? Think about if you had a trauma at home and you yelled for help. If I cut myself in the garage with a lawnmower and I yelled for my wife, this is probably exactly what she would bring out. This is going to do a great job of keeping the shop floor clean. This is not going to do a good job of stopping the bleeding or keeping the blood in. So get rid of the big fluffy things. I see lots and lots of pillows and fluffy stuff, and that's nice, right? Those are great things to bring somebody when they come out of the hot tub. Those aren't great things for when somebody's bleeding. So remember, if somebody's bleeding significantly, right, lots of bleeding is an extremity issue, then we're going to want to use a tourniquet, some kind of a commercial tourniquet, and we'll do other videos in the future where we talk about the different types and how to apply them and all those things, but that's certainly an option. If we're not going to go that route, then we're going to do wound packing using some special technique where we jam aggressively into the wound and deep pack that wound, and then even when we do that, we still follow it up with a pressure dressing. So lots of options, lots of different things, and again, we'll do more reviews and videos on all these things, showing you the proper techniques, but the advantages over something like this is that it doesn't have a lot of loose, fluffy stuff. So we can get this nice and tight on there, and if a patient starts hemorrhaging or bleeding through, we're going to get that feedback right away. The thing's not going to absorb a liter of it before we know. And then if we see that they're bleeding through it, we can make adjustments. If I see some blood on this bandage, I'll usually circle it with a Sharpie and watch it. And if the blood expands outside that circle, then I know I've got to do something about it. So I'll either tighten the tourniquet or add a second tourniquet. If a tourniquet's not in place, then I'm probably going to remove the dressing. And I know that's a huge first aid and EMS taboo, and I'm here to tell you that that myth has got to be dispelled. The old nonsense that if you put a dressing on somebody and it's not effective, that you should add another dressing on top, that is completely wrong. It's a fallacy. If what you're doing is wrong, and you just keep adding more and more wrong on top of it, 2 wrongs don't make it right, 12 wrongs don't make it right, it's not right. So if what you're doing is not working, get rid of it. So if you got 50 pounds of fluffy crap on top, and it does what it's supposed to do, which is be absorbent, and it absorbs a ton of blood, ditch it and do it the right way. Right? So good wound packing, good aggressive pressure dressings, learn the right techniques, learn how to do these things. So, you know, none of these things are super whiz-bang or super high speeds, so it doesn't need to be intimidating, and anybody can do this. So just a matter of thinking about what we're trying to achieve and doing it the right way, and using the right tools for the right job. And probably the most important tool that you can have is your hands. Being very aggressive and very deliberate in what you do and how you go about doing it. Thanks so much for your time. Thanks for watching. If you please would subscribe to our YouTube channel, we'd love it. Please check us out at traumamonkeys.com. Please leave comments down below. And as always, thanks and stay safe.